Hey, okay, so here's part 2 of why I think most women need to not be on chemical contraceptives from a person who's been through it and from strictly the science side of it, you know, put into layman's terms, but not even exploring the religious side of it, which I think is very important. But that's not what this is about. And that's not how I specifically came to the conclusion of not taking chemical contraceptives. But again, I'm Liz Smith and I am a cancer survivor, and I've had it twice. And the second time I had it, it was associated with using the pill. So I'm very passionate about helping women to see that this is not the answer. When you have most people use the pill for 2 reasons: for family planning and for symptoms. And symptoms can range from anything but the most common are heavy periods, endometriosis, PCOS, PMS, all of the things that are associated with that. Sometimes they're prescribed for migraines. They're just all kinds of reasons, and the traditional medical thought is that this pill will fix anything. Well, the problem is, and we just explained that, is that it squashes your body's only ability to make progesterone in large enough amounts to help you out. And one thing we didn't mention about low progesterone is that if you have low progesterone, you will also have low melatonin and serotonin, meaning you're not going to sleep well or feel well. The feel good and sleep good hormones for your brain. So if you keep that in mind, that's one thing. The second reason why I think women need to hear some statistics on cancer with this is because it's cancer. Are we stopping breast cancer? Yes, we are figuring out how to have less women have breast cancer that are over the age of 40. Problem is that the growing area of breast cancers and infertility, all of those things are happening in late 20s and early 30s. And there are several reasons for that. But I think explaining a little bit of the science gives you a better idea. First of all, if you have a child of your own, you know that this affects you differently as far as what am I going to do when my daughter becomes a teen and she has such bad symptoms that she can't get to class, that she misses class, that she is miserable, that she is in such pain, I can't watch her go through this. Every mom is terrified that they'll come to that. You don't want your child in pain. You don't want them hurting. And if the doctor can give them a pill and it will fix it, and she can trade the pill and, you know, trade the money for the pill and just get right back to class and not think anything about it, great. Problem is that short-term fix is causing long-term problems. And if we explain the science of it, hopefully you'll see that. First of all, your body changes obviously a lot between the time you start your cycles at around 12, 13 years old until you are about 25. Your body hasn't fully matured, and your breast definitely hasn't fully matured until you've had a first full-term pregnancy. And we've heard a lot of statistics, and a lot of people know that until you've had a full-term pregnancy and even nursed a baby, your chances for breast cancer are higher than they are once you've had a child, because of how it changes the breast tissue. Your breast tissue changes in stages of lobules, and the types of lobules that are the first types of lobules are lobule 1 and lobule 2 types. And those 2 types are the most susceptible to breast cancer. They are the most vulnerable. They're considered fully formed, but they have not had that full maturation process into a full-term pregnancy. Because once you become pregnant, your body starts changing that breast tissue into lobule 3 and lobule 4, which are the much more protected stages of your breast tissue growth. And once they've matured to that stage, they don't fall back. It's not like creating milk ducts just when you're going to nurse the baby. It's about changing the breast tissue and maturing it. So as your lobules are young in stage 1 and lobule 1 and lobule 2, most susceptible to cancer, then when you have those symptoms of bad periods and acne and stress and headaches and things, and the doctor says, oh, just give her the contraceptive pill, well, then that pill takes a class 1 carcinogen and puts it into your body at the time when your breasts are the most vulnerable. And there have been several studies that have shown that taking the pill at earlier ages and for longer periods of time adds to your breast cancer risk immensely. I can name 9 women in my life that are under 40. Only 2 of them are still alive. Everyone except 1 died before age of 35 from breast cancer or colon cancer and and uterine cancer and ovarian cancer, all related to taking the pill in their teens. And these are not people that I met through cancer circles, because you have a lot of friends whenever you've had cancer. You meet a lot of people that have had cancer. That's not this. These are people that I grew up with, people that I knew from church, people that I went to college with, and they were all put on the pill at very young ages. And that's what the research is showing out, is that if you are on the pill at those young ages, that you have an incredibly high cancer risk. And the way they determine that is through something called the relative risk factor. The relative risk factor tells you if you do activity A, you are either very likely or not likely to come out with outcome B. And when we look at the relative risk factor, that is how they determine that smoking is a very dangerous activity. You ask anyone who has gone through the DARE Red Ribbon program, what happens if you smoke cigarettes? Every child can tell you you'll get lung cancer. We've drilled it well into our kids to know that this activity has this risky outcome for most people. 7 out of 10 people that smoke will have lung cancer at some point in their life, even if they smoked only a year. We know it's risky. Well, the way we know it's risky is from that melting down of statistics into one statistical number called the relative risk factor. And the relative risk factor between smoking and lung cancer is a 3.5, which doesn't sound like a big number, but statistically it is. A 0.5 is a doubling of your risk. So a 3.5 is you have doubled your risk 7 times. Does that make sense? So that's how we know that smoking is very risky. And then we have 7 out of 10 people that smoke will at some point in their life have lung cancer. The relative risk factor between using a birth control pill before age 20, when your breasts are not matured, using the pill before age 20 for whatever reason, and having breast cancer is an 11.5 on that same scale, according to one study. That riskiness is never told to the parent. And as a parent, or even as a young woman making that decision, I am not one to say what someone can and cannot do, but I think full disclosure of what you are dealing with is very important. And the other side of it is the other ones that I've known that have used the pill in their 20s as just putting off their family planning, putting off having children for a few more years while they either finish college or start their career or get married, and they want a few years to get to know their spouse. Those women that I know that have put off childbearing for a few years, 5 years, have an incredibly hard time getting pregnant. And that elevated infertility rate is not really told to you either, because if they can solve it within a certain amount of time by using fertility treatments, they don't call you infertile. Even though you've probably spent thousands of dollars on fertility treatments, trying to figure out why you're broken, why your body won't work, why God doesn't want you to have kids, all of those reasons that we go through as moms and as wives, of trying to determine what's broken in me. Why can I not have children like everyone else? Why is it Susie Q down the street or such and such in that neighborhood? She can pop out babies like no one else, and why can't I? That silent hurt of infertility is something that's not even talked about. A lot of women don't even report infertility because they just simply don't have any money to go and get it figured out and get it treated. So imagine if we could lessen the cancer rates, if we could keep our babies feeling better, if we could do all of this, if we could family plan without taking a cancer-causing agent, wouldn't that be the better way to do it? And that was my initial thought. Then, as soon as we crossed that threshold and said, okay, let's do this, we're not going to take the pill anymore, it's too risky, what are we going to do now? That question was fully answered as well. And I think anyone who is approaching the decision of whether to use the pill or not to use the pill, for symptoms, for family planning, for any of it, if you're willing to look at it and say, what's the alternative, you're going to be very surprised how scientifically based it is, how easy it is to operate. I mean, my husband and I, after a few lessons, could tell you exactly when I ovulate, how and when we are fertile to have children or not have children, and the decisions we make as a couple to decide if we are ready to add to our family or if we are going to abstain and wait at this time and not add to our family. It's very liberating, and it's so much more comfortable knowing that I'm not adding cancer risk and that there are better ways to do it. If you are one that is exploring reasons of not taking the pill, even though you have symptoms and you're scared that your symptoms will come back, there are natural alternatives, and there are so many people that are willing to talk to you about that, of what you can take in bioidentical hormones and how you can take just certain vitamins and minerals that are specific to your body that can keep you from having symptom A, B, C, and D. And I until those have been explored, I would strongly urge you not to take the pill. I would strongly not to take it at all, but especially until you've explored whether or not you are, you can fix this with things in nature that God has already given us, such as bioidentical progesterone. That alone right there would solve half the hot flashes I see in lots of women. I mean, it's just, there's some things, and I'm not even the expert. I am reading books along with everyone else, and there are lists of resources, probably longer than you care to look at just because it gets muddled down. But I would say a great place to start would be Mercola.com, MERCOLA.com, who is a natural health medical doctor. The other one would be JohnLeeMD.com, and that is the author of the book called What Your Doctor May Not Tell You About Premenopause. And that is a book that changed my life, and it definitely had a lot of the information that I just portrayed to you in this video and the previous one. And then probably the easiest book you could get, if you wanted to get one that just says cut to the nitty gritty and tell me what I need to know, would be by Dr. John Lee also, and it's called Hormone Balance Made Simple. And it literally is a simple hormone test to know, oh, I'm probably low in progesterone, and oh my word, my uptake in testosterone is way out of control. And all of those reasons and things that affect your symptoms, you can determine whether or not you need some intervention before you even take a blood test, just based on what you're dealing with symptoms. So I would urge you to look into these things. If all of this is making sense, none of this is making sense, if you want to explore it further and you want to talk to me, I'm very passionate. I want to talk to you and help you to get some information in your hands so that you can make your best decision. You can always find me at on Facebook on my page called Uncommon Talk, or you can call me directly if you've been given this from a friend. I'm always open to talk, and I love sharing my story and telling you that there is hope, and that you're not alone and you're not crazy. And if you want to live a more holistic and healthful lifestyle that doesn't fight against your own body just so you can control symptoms, but to eliminate symptoms, I'd love to talk to you about that. So thank you for listening and to my ramblings today, and have a blessed day, and let me know what I can do for you. Thanks.